Like what Amrit rightly said, the skull base is where all the blood vessels and the nerves from the brain come out from. It's a very tiny area. So we have to navigate around the nerves, around the vessels to remove the tumor without destroying anything else. There's a successful surgery is when a patient goes back better than how he came in. There's no point removing a tumor and the patient can't eat, can't swallow, can't see.
Yeah.
So that's what makes it difficult.
Specialist Centre isn't your typical hospital. It's Malaysia's premier quaternary hospital where rare, complex and next-level care comes to life. This is Quaternary Care, where our team of trusted super consultants are here to take on your toughest health battles using advanced technology and research-backed treatments all under one roof. Now, back to Nadia Azmi for UMSC's QRATED podcast.
Hi everyone, welcome back to part 2 of QRATED. I'm Nadia Azmi, your host, and for this part 2, we will talk about the topic of ears, nose, and throat when they meet the brain. So we have 2 specialists in here for part 2, nerves of steel, surgeons at the base of it all. Still with us is Professor Dato Dr. Prepageran Narayanan, who is a consultant ENT, head and neck surgeon from UMSC. Great to still have you here, Prof.
Thanks for having me.
And also Dr. Amritpal Singh Sidhu, who is a consultant neurosurgeon also from UMSC. Okay, Dr. Amrit and also Prof. We will talk about advanced treatments, surgical technologies, complex cases, and of course, the role of UMSC as a quaternary care center for this part 2. So we talked about earlier how both of your expertise or professions and areas of expertise intersect, how do they intertwine, come together, why it's important for you to work together to give the best outcome for your patient. Now, we want to talk about the treatments and the technologies that are behind all of that. Okay, so for the both of you, we did touch a little bit about skull-based tumors, but maybe you can tell us what is skull-based tumors, why are they so complex to treat? Dr. Amrit?
Yeah.
Yeah?
So skull-based tumors are basically tumors which are on the base of the skull. And most of the time, these tumors are benign in nature, most of the time. And these tumors are a bit more difficult, I'll say. It's just because of the excess of it. So the tumors which are on the superficial surface of the brain is pretty straightforward. We can just access it via doing a craniotomy. Yeah. So the ones which are on the skull base, it's a bit difficult to approach previously. Now we can, like I explained earlier, we can go through the multiple orifices and remove these tumors. And secondly, the vital structures that are around the base of skull. So you have your major blood vessels there, you have your major nerves, cranial nerves, and also your brainstem is there. Yeah. So any tumor, when it grows big enough, it can compress on these vital structures. And so removing these tumors, you will also have to be careful of the surrounding structures, not to damage or injure the surrounding structures. So that's why it's a bit more complex than other tumors.
Yeah.
Yeah.
When it comes to skull-based tumors, I just want to know your patients, the age range of your patients. Do you get a very wide age range, or is there a particular a number where patients or people get tumors like these, or do you see it in your younger patients as well?
I'll say there's a wide range. Yeah, there are some younger ones, some with some syndromes behind it, and they might have this skull-based tumors, and the older age as well. So yeah, it's all across the demographic, I'll say.
Prof. Prepa, what about from the ENT perspective on access and anatomical challenges that you face when it comes to these tumors?
Like what Amrit rightly said, the skull base is where all the blood vessels and the nerves from the brain come out from. It's a very tiny area. So we have to navigate around the nerves, around the vessels to remove the tumor without destroying anything else. There's a successful surgery is when a patient goes back better than how he came in. There's no point removing a tumor and the patient can't eat, can't swallow, can't see. So that's what makes it difficult. In other parts of the body, the exercise is much easier. Here, you have to navigate around structures that cannot be moved. So you literally have to navigate into corners identify the lesion, remove the tumor, and preserve as much function as possible.
You're not a contractor or a builder who can
No,
just
it's
simply,
not.
shift fixtures
This
here
is
and
like
there.
more like Mission Impossible. So you have to go to corners and nooks.
Real.
Yes, to go to corners and nooks.
yeah.
Because at the end of the day, a successful surgery is when the patient goes home better than how he came. But there's no point in us removing the entire tumor, but the patient can't eat, can't swallow, and has to breathe through a hole here. It doesn't make sense.
Yeah.
So it takes a lot of judgment call, a lot of experience to know what to take, what to leave behind. Quality of life is very important.
So what kind of challenges can you stumble upon during surgery?
Oh, where do we begin? It depends on the location of the tumor, where the tumor is. So if a tumor is near the muscles of mastication, like the chewing, for example, behind this, where the muscles of chewing is.
Okay.
So if we remove the tumor and damage the muscles, the patient cannot open the mouth. It causes trismus. So they go into a permanent state where they can't open the mouth. So can you imagine doing a complex surgery and the surgeons are so happy, oh, we've removed the tumor, but the patient can never open the mouth anymore, can't eat. So it's a delicate situation. You must have the knowledge, experience, input from your colleagues,
Right.
and make informed decision. You explain to the patient these are the issues. If we do this, this is what may happen. If we do this is what may happen. And then walk a mile in the patient's shoes.
Yeah.
Always ask yourself, if this is my son, what will I do?
Yeah.
I think that's very important as well.
So I think it's always your end goal to make the patient's life get better
Correct.
and easier and
So
less inconvenient.
There are enough time to tell the patients, let's wait and see. Because we might do more harm than doing surgery.
That's why that prep, I think, is very important.
Yeah.
That step before you go into the OT, there's a lot of things that need to be assessed,
Considered, yeah.
evaluated,
Yeah.
and considered. Yes. Now, we talked about in part one how the surgical procedures are very less invasive these days. So how have minimally invasive surgical approaches actually changed the outcomes in both ENT and also neurosurgery? Maybe Dr. Amrit, you can start first.
Yeah. So in neurosurgery, the major thing that happened was probably the image guidance system. So it's like a GPS system. So it exactly lets us know where the tumor is.
Yep.
So by knowing that, we are able to open a smaller opening and be very precise about it. So by making a smaller opening, the wound heals better, the morbidity to the patient improves.
But is the procedure more challenging when it's smaller?
Not really. So depending on the location,
Okay.
then we are able to just remove the tumor depending on the location again. But of course, this technology does help us to reduce time and to get to the tumor as fast as possible, because sometimes time is the essence as well. We
Yes.
can't, wait around and, do the surgery. So if you are doing it with these technologies, with the IGS, with your microscope, it helps you see the surrounding blood supply. Yeah. So, and other machinery as well. So it helps us in improving the outcome and the time during surgery as well.
And the technology that we are using today will also help expedite or fasten the recovery process, the recovery time. Is that true?
Yeah.
Yeah, that's possible as well.
Definitely. Yeah.
Okay, that's good news to everyone out there. From an ENT perspective, Prof.
Let me give you an example. For example, let's say, a patient has got a tumor behind this, it's called maxilla, right?
Okay.
So when I started my training in 1993-94, the surgical treatment of choice was you cut under your eyes, cut down here, cut
Okay.
down the lip, take off the skin, take off the maxilla, and then you operate with a head slide inside.
Oh.
That was 1991, 1993.
Okay.
Then came endoscopes. You've seen these Mission Impossible movies where they make a small hole in the wall and put a flexible scope and you can see the entire room. So now we do the same surgery through the nostril
Without
with
moving that part of the
nothing.
face.
In fact, 90% of the surgery, almost 95% of the surgeries that we used to do by cutting the face, we do to the nose now. And that's what we specialize in. And we operate on areas of a few centimeters
Okay.
on a 40-inch TV screen, on a large TV screen, and with a high definition. So we can see things very clearly. And a lot of these patients after surgery, they are like as if they had sinus surgery. They are very comfortable. So that's technology. If that can happen in my lifetime, can you imagine what's going to happen in another 20, 30 years?
Yeah, that's absolutely brilliant what technology and innovation
Yep,
can do.
yes, yeah.
And now we know where you get your inspiration from.
Mission Impossible.
Impossible. That's what has inspired you to do what you do today. That's great. Yes. And at UMSC, you support complex multidisciplinary surgeries. That's why we call you a quaternary care center. And this type of approach might not be available elsewhere in other institutions. So what makes UMC uniquely positioned for advanced ENT and neurosurgical procedures compared to maybe other centers in the country?
I don't think it's really true. I think quite a lot of UMSC is part of UMMC.
Okay.
So both UMSC and UMMC is identical. We are the same team.
Okay.
The only difference in UMSC caters to the private people who want private treatment with insurance and whatever not.
Right.
Those without, we can always do in the government side. The teams are exactly the same.
People.
The instruments are exactly the same. It's just that maybe the waiting time is slightly shorter on the UMSC side.
Right.
Yes.
Right.
But yes, this technology is available in a lot of the other hospitals as well. I think the advantage we have is probably we have more experience because we end up doing more complex cases. Because we by the virtue of working in PPUM, where we get a lot of referrals, so that all the consultants in UMSC who are also consultants in PPUM have seen the entire breadth of cases. So I think they are experienced lot. Yes. But UMSC is the same. University Malaya.
Yeah. I mean, the talent, the driving force behind it is all of you, the same team.
Right.
Dr.
And
Amrit.
probably we got a good team behind it. So means we have like we mentioned in the case earlier, we have the interventional radiologist who's really experienced. And for care after surgery, we have oncologists as well, your radiation oncologist, your medical oncologist. So you can get a wholesome treatment, anesthetist during surgery. So all throughout, we have the best to get things done. And you can do it in one center. The pre, during surgery and after.
But what's great at UMSC is that all of you are under one roof.
Yes.
So you are all colleagues under the same institution. So, it's very easy to coordinate with each other, to speak with each other, to communicate with each other.
Right.
So how do you think this, I mean, we've seen how you illustrated a case from a patient that came from another country, how you work together to give the best outcome for that patient. Maybe you can tell us as well, how is it that being under one roof in the same building helped improve not just that patient, but all of your patients for their outcomes, especially for difficult cases? Why is this collaborative effort so important?
We are a teaching institution and we are both undergraduates of University Malaya. So this is, UM is our home.
Yes.
Yeah, that's probably why we are still in UM, because
Very loyal.
we are home. This is our home. And because it's a teaching center, the collaboration has always been there. So even from the time of medical student, I've seen cases that were always being managed by different specialities. Like the buffet I was telling you about, the pasta maker makes pasta, Dorchana makes Dorchana. So it makes life easier. We don't take unnecessary risk. Everyone does what they are an expert in. And the common goal at the end of the day is that the quality of the life that the patient has got. They must always go back better than they come as much as possible. And it also, because we're a teaching institution, we don't just teach medical students and master students. We also have people who come from overseas for fellowships as well. And they see the collaboration we have, the team spirit we have, how we discuss together before we do surgery, and how we manage complications that can arise when it does happen. And this inspires them as well. So a lot of people who have come for training with us now are back in their home countries, leading institutions as well.
Now, Prof, you speak on international stages. You contribute extensively to research. You have a very illustrious career journey. We've read your
How did you get
your
my
stories.
Oh, okay.
Oh yes, you're known. You're well known, Prof. So how does UMSC balance between clinical excellence, and then you talked about you are a teaching institution, right? So how do you balance clinical excellence and academic leadership?
It's a good question. So for me, my personal experience is UMSC, UMMC is the same. I treat everyone, both UMSC and UMMC, the same. It's University Malaya, our home, our mothership, basically. So, it's the same ground where we offer the best possible as far as clinical service is concerned, and we always have look out for what we can improve ourselves. So, one of the advantage of having students around you all the time, master students, fellows from overseas, they always ask you, why are you doing this? So we end up improving ourselves all the time. But if you are in a situation where in a place where no one asks you any question, you make all the decisions yourself, and there's no one to stimulate you. It's quite easy to think that you are the end all of everything. So it's a very interesting environment that UM has got. UMSC, UMNC, it's the same. University Malaya. So it nurtures academia, and most of us treat UMSC and UMMC the same work we do, patients are the same, and we use the resources in both places to write papers, publish studies, and so on.
I think as educators, you always stay in touch with what's
We
happening
have to,
in your
yes.
industry, in healthcare.
Yes, we
And
have to
that
pass it on,
prompts you
no?
to do better, to search for something better.
Exactly, you have to pass it on to the next generation.
Right, right. Okay, Dr. Amrit, you also have a very illustrious background as well. You've trained in Oxford, you've completed fellowships abroad. So how does your experience internationally have shaped the way you approach complex cases over at UMSC?
Right. I think the major thing I learned there was the multidisciplinary approach of doing things. So before we do a case, which similarly we do here as well, we have a discussion with all our colleagues, not only from neurosurgery, from ENT, from oncology, from radiology. So you get like a wholesome treatment. And also there's a check and balance that goes on. So just to make sure everything is going as it's supposed to go. And so then that approach is brought home, and we are doing it here as well. So we can get a proper treatment, and we are able to give a comprehensive treatment to the patient.
So you have seen how things are done in the healthcare sector overseas, globally. How do you think we have fared here in Malaysia?
I think we're doing very well. So we have fellows who come from all over the world. So we've had fellows from Europe, from UK. We have fellows who come from all over the world. So the healthcare in Malaysia is as good as any Western world.
Yeah,
I agree.
we're very advanced.
We are,
Yes.
and even the Ministry of Health, the universities, the equipments are fantastic. It's very good.
I think that's why Malaysians are very blessed. We have the best technologies and also facilities.
I don't think they realize that.
Yes.
Quite a few of them don't realize how lucky they are.
Sometimes maybe we tend to focus on the other parts
Right,
of
yeah.
the waiting time at the hospitals. We have to realize there's a lot of people who need treatment.
Yes. But if you look at the waiting time, for example, in
Yes.
the UK,
Uh-huh.
the NHS, or you can't just walk in and see a specialist in most parts of the world. Here, you can just walk in and see a specialist in the private sector if you want, and the healthcare is accessible for a few ringgit or free in the
Yes.
government clinics.
Yes.
And these are manned by very good people.
Yeah.
So I
Especially
mean,
at UMSC is very efficient. I think the way they do things.
Yes, of
to
course,
help
yes.
ease the
Yeah.
journey. I mean, you're already coming in with a medical condition or with so much, so many worries, and you just want to be able to access healthcare as easy as possible, as
A
fast
seamless
as
journey.
possible. They want a seamless journey. I
Yep,
think that's
that's
what
true.
UMSC can provide with all of you, working together.
UMSC and UMMC,
UMSC, okay.
University
got it.
Malaya,
Right, yes.
the same team.
Yes. Okay, now, what advice would you give to patients who are facing a diagnosis involving the skull base or brain adjacent structures? They may be feeling overwhelmed. This is a very daunting journey for them. They don't know what to look ahead to. What is the future like for them? So, what would you have to say? Dr. Amrit?
Yeah, I think the important thing is doing it a step at a time. So meaning there's investigation that needs to be done. You can do your CT scans, your MRIs, so that we can come to a sort of radiological diagnosis. And from there are all these options. We'll give them the options, what the options of treatment is. And judging from there, let's say a biopsy is done or a surgery is done, we'll have a histopathological diagnosis where you'll know what exactly you're dealing with. And from there'll be treatment options as well. So there's step-by-step approach to coming to a concise treatment. And I think every step of the way we'll be there to just let you know what the options are. So it's understandable to be overwhelmed, but if you approach it step by step, I think it'll be all right.
Prof?
I think you need to see the right people.
Yeah.
So the most important thing is when you have a problem, ask around, get referrals, and see the right people. People who are familiar with the conditions you have. People who have seen it before, done it before, and who can simplify the procedure for you. So it's always good to do some background check and go to the right place. I think that's the most important point that I can make.
So the Malaysians should know that at UMSC, for example, they can always be in very good hands, in the best care possible.
And UMMC as well.
And UMSC, yes.
And UMMC and UMSC as well, yes.
That's right. Okay, now before we conclude this conversation, let's give a quick PSA to all of our viewers and
PSA?
listeners, a public service announcement. But I think you've been giving a lot of that already throughout the chit chat.
PSA is a poster-specific antigen, so it's a different. Okay.
This is a different kind of PSA.
Right, okay.
This is specifically for the podcast for QRATED. What are the 5 red flags that people need to know when it comes to their brains, ears, nose, and throat that need immediate medical attention, and why? So let's close off with that. Can I start with Dr. Amrit? So the 5 red flags. So for you when it comes to the brain.
I say severe headaches, seizures, double vision, weakness on one side of the body, which is called hemiparesis or hemiplegia. And altered consciousness, I'll say.
Okay, thank you for that. 5. I hope our listeners are taking down notes. And what about ENT?
Okay, since I have ear, nose, and throat, so it's a much bigger area than the brain. So I would say a persistent bleeding, number 1, whether it's from your nose, from your throat, or from your ears. Swelling that is progressive, regardless where.
Okay.
The neck, the face, behind the ear.
Okay.
And then pain that is persistent as well. Bleeding, swelling, persistent pain that is getting worse, that is radiating. Discharge, nasal discharge that is purulent or that's significantly getting worse. Ear discharge that is significantly getting worse as well. And also vision abnormalities because the sinuses in the ears are very close to the eye as well.
Okay.
Pain, swelling, bleeding, vision changes. What's the other one I told you?
You're quizzing me now.
Just checking on you.
The bleeding, right?
Good for you.
Persistent bleeding. Thank you very much to
My
Prof.
pleasure.
Prema
Thanks for having
and
us.
also Dr. Amrit.
Thanks for
A
having
lot for us to digest and absorb and unpack. I mean, yes, it's a very sophisticated world out there for the both of you, what you do. But thank you for giving the best to patients, to your patients, and to all of us out there, and also for educating.
Thank you very
I
much.
think that's a very important element when it comes to whatever it is, whatever industry and field, that education is always important because with
Pass it on.
education, then comes awareness. For people,
Yes.
awareness and in this context to take care of their bodies and of their health. So thank you for that. I hope with this conversation, people have gained a newfound appreciation to what modern medicine can do, to the technologies and innovation that's available out there. So if you need to get treated, go and see a GP, go and see a specialist. So thank you again to the both of you for giving us a look into the collaboration, the incredible collaboration that goes on between the both of you, what goes behind the scenes to ultimately save lives. So to our viewers and listeners out there, do yourself a favor. If you feel something is not right with your bodies, go to the hospital, pay a visit, bring a friend or a family member if you need to, get yourself checked so you get the treatment that you need if there is something wrong with your bodies. All right? Don't be afraid. Don't be afraid. You have great doctors like Dr. Amrit and also Prof. Prepa. Now, if you're curious for more stories like this, check out all the other episodes for QRATED, and don't forget to QRate us by sharing, subscribing, commenting, and liking our videos. We've talked with a lot of experts and doctors who have shared us many inspiring stories all in the name of good health. With that, I'm Nadia Azmi. Remember to stay curious, stay informed, and of course, stay healthy. Goodbye, everyone. Take care.
Did you enjoy today's curated episode? Well, don't forget to tune in for the next episode of Curated Podcast by UMSC. To learn more about our consultants, specialties, or to book an appointment, visit umsc.my. For health tips, behind-the-scenes content, and expert insights, follow UMSC on Instagram, Facebook, TikTok, Spotify, and Apple Podcasts. Till next time!